What we do know about smoking and lung cancer is that if people can stop smoking even after a diagnosis of lung cancer, and ideally even before treatment starts, but whenever, that you can improve things, that you can improve survival, you can live longer, and that's across all stages, and that treatments for lung cancer will work better. And you know, some of the treatments you may be facing might include radiotherapy or some drug therapy, chemo. We certainly know that people recover better from surgery if they've stopped smoking. So there's some really, really specific reasons for you. And so even though you think it's too late and it might feel too late, it's not at all too late. This is a really important time and a good time to stop. What do you think? Would you be willing to give it a try?
Look, yeah, okay, I'm willing to give a try. I don't see it as being particularly easy. What do you think?
Well, I think you're right. I think it's not at all easy. It's different for different people, but I always go into it assuming that it's really hard, and that anybody who has to do it, particularly with the stress of going through the diagnosis and treatment that you're dealing with now, is that it'll be a little harder because often people smoke to alleviate stress, and that we need to give you every bit of help we can think of that's appropriate for you, discuss it together carefully, and frankly actually get on with it. Sometimes it can take a while, but I think we should assume that we should try and ramp this up a bit to do this. Generally, if I'm trying to help somebody stop smoking, I will accept that it can take months. You know, if we're not dealing with lung cancer and the need to start treatment. In this, and look, if it does with you, then it does. As long as we reduce your cigarette intake and we work towards it, that's what we'll do. Ideally, super ideally, we'd get you to stop before your treatment started. Now, I know that's soon. That might be unrealistic. We don't know. We haven't tried. You've not had any help. This is very new. But even if we could reduce your cigarette intake, could we halve it soon? Over, I don't know, a couple of weeks even. Could we then halve it again? That sort of thinking.
So you think that's possible?
Yeah, I do. It might not, you might have moments where you go backwards a bit. Most people do. Most people need several attempts to quit cigarettes before they're successful. So a failure is just a step in the journey. And whether that occurs over 3 months or 6 months, or where we squish it all into a few weeks because we're in a hurry, most people need a few goes. So even if you think, great, I have stopped, and then very quickly you find yourself smoking a cigarette again, don't despair. That's part of it. That's normal and that's part of it.